Good evening, everyone. Thank you so much for joining us. Thank you for being here for another Mental Health Matters chat with MAO Behavioral Health. In just a few short moments, we will be welcoming our panelists to join us. They will be helping to answer questions, share their views, thoughts, and opinions, not to mention their informed positions on many of the things that are impacting us today. I'm Thomas Stevens. I'm the Manager of Communications and Marketing for Medical Advocacy and Outreach, or simply to many, MAO. I will be serving as the chat moderator for this program, and again, I am thrilled to be here. I do want to make sure that you can all see me, and if you can't, please make a note in our social media chat boxes. I will be monitoring them. For those who are less familiar, MAO was founded in 1987, making 2022 the agency's 35th anniversary year. So happy anniversary to MAO. Over the course of 35 years, MAO has evolved to serve the specialized care and health education needs of more than 2,000 patients and an average of 4,500 community learners spanning 18,635 square miles of South Alabama. That accomplishment was done not only through determination, but through extraordinary partners across the state, throughout the region, and throughout the country. Many of those partnerships gave way to programs and services that we could have never envisioned in the beginning. In starting in our roots from HIV and learning from that service the specialized care that goes much beyond HIV, and that is looking at the entire person. For those who are interested in improving healthcare for themselves or others, this is why we commit ourselves to doing these live stream chats, because we know that part of improving health has to do with public understanding and allowing us all to be engaged in active discussions of learning and questioning and action. This evening's chat will focus on social trends in civic and behavioral health. This evening's broadcast, we're actually presenting in joint partnership between MAO Behavioral Health and MAO's Division of Advocacy and Civic Health. I'm sure as we proceed through this evening's program, you will completely understand why this particular program was presented as a joint collaboration, partnership, thought process, you name it. So I would like to ask that you all help me to keep us on track. If you have questions, please post them in the chat box as we continue to move into it. I will be bringing our chat group into the stream, and I will be introducing them to you. We're actually thrilled to have four wonderful people. They each bring rather unique mindsets to the conversation, to the table. Joining us, we have Doug Mccloud. I believe he may appear for some people's screens in the bottom lower right. Doug is the Manager of Consumer Support Programs for Medical Advocacy and Outreach. He is someone who truthfully, he lives the mission. He focuses on really understanding what our clients' need and making sure that they have a voice in not only the service they're receiving, but as we evolve the direction that the agency is heading. Also, I believe second down on your screen is Landon Nichols. Hello, Landon. Landon is the Manager of Advocacy and Civic Health. I think in some places I put outreach, but I do believe your title got tweaked, did it not? Okay, so he's the Manager of Advocacy and Civic Health. He is someone who truthfully keeps not only MAO, but MAO supporters actively informed about what is happening, what is changing in the particularly the legislative sector, but also just kind of in a social context about things that are impacting not only our services, but our clients. We also have Deidre Roberts. Deidre is that smiling lady there waving her hand. She is the Behavioral Health Program Specialist, which is a senior staff role within our MAO Behavioral Health Division. She has in some cases, kind of a role that I'm envious of, because it allows her to really play a on the ground role in all of our behavioral health programs, and also in how they interconnect with other services, not only from within MAO, but with our program partners elsewhere in the community. And then last but not least, the gentleman who was sitting there with his rather sharp specs going on there, you can see partially his side profile, but he's smiling now, is Glenn Winkler. Glenn is a behavioral health therapist. He actually is someone who has a rather extensive background, but I did promise our panelists that I was not going to sit here and read their bios like a lecturer, but I do want to say that Glenn has an extensive understanding not just of therapy processes in a variety of settings, but he also has a specialized understanding of substance use disorder and how that has so critically influenced so many. So I welcome you all. Thank you for joining us. And if I could ask each of my panelists just to kind of say howdy, so I know that you can hear me and everyone can hear you.
Hello.
Thank you, Glenn.
Hello.
Hello, everyone.
There we go. That's what we want to hear. So this evening, we kind of have an ambitious agenda, but again, if we see your comments in the chat box, who knows? We may also just create a part 2. But we are focusing on the social trends in civic and behavioral health. And I think because we actually did a program very similar to this for our staff, which many of them are still talking about a few weeks ago, I would actually like to center Landon out and ask him if he couldn't just kind of put in his own words how he sees that. What is his interpretation of social trends with regard to civic and behavioral health?
Well, there are so many. I mean, that's a big, broad question. So kind of, I guess to back up, let's frame a little bit about what civic health is. So, you hear people talk about voting, you hear people talk about advocacy, talk about calling your legislator. That's all part of civic health. There are multiple ways that we measure civic health, and it's really kind of 3 main areas. It's social connectedness, it's political works, and then it's advocating with members of your community to get something good done. And so this can even be non-traditional things like going to group meetings like a Rotary Club or an Exchange Club. Can mean belonging to an organization that advocates for an issue that you really care about. So for us, it's, HIV and substance use disorders. For other organizations, it might be transportation or the environment. There's so many organizations out there that can give you an outlet to affect policy and policy that you really care about. And so I guess I would say, what are the trends within civic health broadly? I think it's no secret that we are seeing extreme polarization in this era. This isn't the first time in American history there's been extreme polarization, but it's probably the first time in all of our lifetimes that it's been this acute. I think that in and of itself is emblematic of a breakdown in the civic commons and in civic health. And it's really indicative of this environment that we're in, where we get so much of our information from social media and from media sources that maybe confirm biases that we already have, instead of getting the full picture of information that's out there. And we're in an era where we are also digitally connected and where information is so accessible, but in many ways we've never been more isolated. As you see all of us coming to you from different places here tonight, even though we were able to come together in these virtual venues, in many ways, we're all still isolated in our own pockets. And that kind of robs us of the opportunity to build understanding from other people. So that is kind of, I would say, the biggest trend in civic health right now is kind of this growing apart of people. And I think the more that we can engage with our community members and even engage with people that are different from us and think differently from us, I think we'll have an opportunity to grow and to be able to address these issues better.
Thank you, Landon. I think you articulated that very well, because I did purposely put you on the spot, because one of the things that even for our own staff that was very clear was this. Honestly, it's not a failure so much as kind of just a naivety understanding civic health and what that means and how interconnected it is with so much of what we do. And I think when we're looking at a lot of these issues that are impacting us locally, regionally, state, nationally, that's part of where the challenge is getting back to looking at how things are interconnected and the different ways that either by action or inaction, we really start seeing, what is happening or not happening to improve situations and improve people's lives. I think, we have a couple kind of big topic points that we want to try to give each of you an opportunity to share a view on. And again, for the viewers and the listeners, each of our panel brings a slightly different perspective to the table. But I think, they all basically sit in that platform of really want to sincerely use their experience and their knowledge to improve people's lives. So the first issue, which I'm sure will, again, come as no shock to Landon, because Landon has stayed in the weeds with this for the last several years, but it has to do with access to mental health care and health care in general. I think this is something that I think we ended up when we spoke to the staff about it, ended up being on the back end of the conversation. But for this public interaction, I really wanted to bring that to the front, because I think so much of the other points we're going to discuss on this evening directly or indirectly link back to it. So I think first I'll ask Landon to start again, and then I think if you could just kind of frame that, because this is really about making sure we're aware of what the issue is and what's happening. And then I think, I would love to jump to Doug and then to Glenn. So we kind of get two different views from the consumer versus the practitioner. So Landon?
Sure. So this is a line that I've said a few times over the last few years, and it is as true today as the first time I said it. We are closer to Medicaid expansion in Alabama than we've ever been. There are still a few roadblocks, there are still a few hurdles, but we are closer to getting Medicaid expanded than we've ever been. And so why does that matter? Why does Medicaid expansion relate to this? There are roughly 300,000 Alabamians right now today that are either uninsured or underinsured. And without insurance coverage, it becomes really, really difficult and expensive to access all healthcare services, but particularly mental health care services. And Thomas, I'm so glad you mentioned kind of the interconnectivity between so many of these issues, because this is a kind of a fundamental framework that we look at these issues through, and it's a term called intersectionality. And we'll be talking about that more throughout the night. It'll come up several times, but really it's this idea that we are whole people. And so when we look at these policy issues, I, as an individual showing up, am not impacted by just Medicaid expansion or lack thereof. I'm also impacted by the gun laws, by the LGBTQ laws, by all the laws that are being passed. We're whole people and we're affected by many things. So in the beginning of this conversation, I think it is important to talk about insurance coverage and Medicaid expansion, because having access to the healthcare system is so fundamental to addressing so many other needs.
Well, not to interrupt you, but it might also influence some of what you wanted to say. But am I correct in stating Alabama is, I think I can't remember the exact statistic, but we are literally still on the docket in terms of a shortage of mental health providers. I mean, medical providers as well, but specifically mental health providers. So when we talk about access, we're looking at both literally cost and availability of services.
Right. So, I mean, it's a natural chicken and an egg scenario, right? So we are not going to have enough providers to provide care for all the people that need care until we have enough people that have coverage that can pay those providers. So it really is a chicken and egg situation. And really the only solution there is to get coverage to people, because once we have coverage and have more money in the system, we'll be able to recruit and employ more behavioral health professionals. But yeah, so getting that coverage is absolutely fundamental. And it's not only an access point for behavioral health and physical health, but it's an access point to so many other social services. Because so often, people in the community, their main interaction with kind of formal structures and formal organizations is with healthcare. And so that is a natural entry point to get other services. And for folks that are uninsured, it's a big barrier just getting to the door. So yeah, getting Medicaid expanded and getting coverage for those 300,000 Alabamians is critical, and it's top of our issue agenda, and we'll keep pushing for it. But I know it is affecting a lot of people out there, so I will throw it, I guess, to Doug and then to Glenn to talk a little bit about the experience.
And for later in the program, we will come back just to touch on that, because I do want to give you the opportunity just to kind of enlighten those who may not be, accessible to a random newspaper headline or something, just about some of the action steps that are underway to make that possible. But yes, let's move on to Doug. We really, I think, you not just from your own personal perspective, which obviously we do want to hear, but literally from the lens of looking at the patients and the clients that we work with on a daily basis. I wonder if you could literally look to that human component about that access, about those issues that they're facing. You're muted, but I will see what I can do to try to help you here. Try it again, Doug.
Can you hear me now?
We can hear you beautifully.
Oh, okay. Connection is going in and out, so I didn't hear you. I tried to put in the message, but I don't even know if it went through or not.
That's quite all right. But still, the question really directed to you. Were you able to hear what Landon was saying?
A little bit. That's why I was trying to.
Okay. Well, Landon really, he kind of put an excellent framework about we actually are thankfully in a more of a positive position to look at Medicaid expansion, but there's still so much work to be done. And we touched on also about the shortage of mental health providers and even medical providers within the state of Alabama. So, you know, armed with that, I was asking you to kind of look at it from our client's perspective, from those we serve, and add that kind of in the now real person response about what the experience is observedly like for them. Trying to find access. What does it mean to have access to them, and the barriers they're running into?
One, because there's not a lot of providers, you only have a handful who will see particular clients.
And when you say will, can you kind of elaborate on that?
Well, a lot of times stigma comes into play with a lot of healthcare issues. Sometimes providers don't want to see the client because they may not be insured, or if they are insured, it may be particular medical situation they have that they may not be able to actually assist that client. And it can be from various perspectives. Sometimes it could be the HIV, or it could not be, or sometimes you don't have enough medical providers who that the providers can lean on if they need other assistance, as well as I see clients are always complaining about dental. I see a lot of clients who complain about having just a primary care doctor.
Well, that also touches back on, again, I'm kind of clarifying about that interconnected that we were talking,
Right.
Intersectionality, I believe is how
Right.
But I didn't mean to interrupt you. Keep going.
And having someone actually just having enough providers that will actually listen and understand their situation as it relates to whatever they're dealing with. A lot of people are intimidated because they feel like they may not fit the criteria for the type of audience or the patients that the doctor sees. It's a lot of different things that clients tell me that sometimes we may take for granted. That do you feel like that's why? It was like, well, I feel like if I go into the doctor's office and I am on fixed income, or people are looking at me as if they already assume that I can't afford it, or I don't have insurance. Sometimes they get a different treatment from people if depending on the insurance that they have, or if they don't have it at all.
And I think, just again for our viewers and our listeners, that was also one of the reasons that I had Landon kind of start that, because so much of the other topics that we get into, they are going to loop back to that. And I think, I can add from my own experience and my loved ones and everyone around me. We look at it often from an institutional perspective, but we're not looking at it as the service beneficiary, the person's perspective. And
Right.
I think often that is where we can find the answers, or at least we can find the message that we need to push so action can take place, is that this is what people are running into. This is what is happening. I think the important thing for all of us, and I know everybody in the panel agrees with me, is to do what we can to try to bring these issues to the surface, while we're also trying to reinforce, particularly those who are watching and viewing with us this evening, that they're not alone. Many of them are experiencing this, and there is such an increasing need for all of us to come together in our understanding and to find out more, even about these pieces of our daily lives that, like you said, Doug, some of us take things for granted. Other people, they just have not been privy to that information, so they don't feel like they have the confidence or understanding to take the action. So I would, from this point, I just want to kind of segue over to Glenn, if he wouldn't mind, because I think when we're looking at so much of what people are going through, I think often we forget, even if they're facing a medical or physical issue, the impact on their behavior, on the mental health, also can't go unaddressed. I mean, that's one of the reasons when we see so many other issues going on in our country and everyone wants to keep screaming mental health, but again, it's that intersectionality. It's getting people to realize that we have to kind of look at all of the pieces of the pie and try to find those answers. Glenn, could you kind of take that framework that I gave Doug in terms of looking at it from the patient's perspective? Would you mind commenting on it from a provider's perspective?
What I basically encounter again is access to services. My professional background, the majority of my experience has been working in substance use disorder treatment clinics. And for many years, I was an assessment specialist, meaning I was the person who, when someone came to a program, and of course, this was pre-pandemic when, before telehealth became as common as it is now, but someone came to a program and I was the clinician they met with, did their evaluation to see what their issues are, what level of services they appear to need, and then to try to connect them to those services. And all of the issues that Doug mentioned, that they remain problematic. There are limited providers, and what providers there are very much dictated by the financial and other resources and access to health insurance that prospective clients have or do not have. Generally speaking, someone with health insurance has a much better chance of quickly accessing treatment services for substance use disorders. Someone with Medicaid, there are more resources available. Someone who's uninsured, lots of programs, they will bill on a sliding scale fee, that type of thing. Though the Department of Mental Health, at least this is the way that it used to be, and if it's changed, I missed the email, but the programs that are licensed by the State Department of Mental Health and funded by the Department of Mental Health, meaning that, a program, they can work with someone and then submit billing to the Department of Mental Health for reimbursement for that service, that the client does, they can impose an additional fee, but the client doesn't, insurance isn't paying for it and the client isn't paying for it out of pocket, though they may have, an additional sliding scale fee. But a program funded by the Department of Mental Health, they can't decline someone for services because they have no money. So they can treat people. Sometimes people will have a bill, different things. But that said, the process of connecting people from initial point of contact to assessment, to a program, to intake, to admission, that can take several days to several weeks to honestly several months. There are lots of factors that affect it. And unfortunately, clients get frustrated. They feel dehumanized because especially if they don't know what the system really is like, they're like, well, I need help. Why aren't you helping me? And you're like, we're trying to help you, but there's a system and there are steps that we have to follow. And a lot of it's driven by, rules and regulations that you've got to follow, funding sources and such. And often these are persons who are in dire situations and, maybe not 911 or, now 988 for a substance or mental health emergency situation, but, they need something to happen quickly, and it doesn't happen quickly enough. And we lose a lot of people to attrition because they give up on the process because we're not able to connect someone quickly. And as a provider, it's frustrating because there's a lot of stuff that's out of your control, and you do the best you can with what you have to work with to do your part and move the process along. But just even when the process works well, sometimes it doesn't work as quickly as it needs to.
Which kind of brings me to, in some cases, maybe a kind of a very pointed question. And I think I'm going to ask Deidre to be the first to respond to this one, but I'm pretty sure that all of you have a significant response to share about your views and your experience with this. And without me over elaborating, how have the national trends impacted the lives of our patients? Just to provide a few examples, we have the gun control laws and the debates surrounding them. Parents and providers of school-aged children and the debates about what can and cannot be taught. We often don't think about the emotional impact that goes with parents and citizens that are confronting those issues, regardless of which side they sit on. So, Deidre?
In my position, I am afforded the opportunity to make first contact with people who are many individuals who are at some type of I don't want to say crisis, because all of them are not in crisis. They're just at a place where they want help or want to talk to someone immediately. They're seeking some type of immediate intervention. And doing that, I come across a lot of individuals that are experiencing they're experiencing the things like gun control, the laws, especially the laws that are being passed, the elections, the insurrection hearings. All of those are affecting them in a way of worry, consume fear, especially for our parents who have children, and as they're getting ready to go back to school. Even if it did not happen locally, there is something that's happening locally that is affecting the education department. So they have a lot of questions, and sometimes a lot of those questions and concerns can consume their thoughts, which now we're into mental health, because they're so consumed with concern that they can't think of any. They're irrationalizing things now. So a lot of worryation, a lot of anxiety, and honestly, a lot of it is it goes untreated. And the reason I say that is because people don't really notice some of their behaviors changing in the midst of those things. So they don't notice that they have maybe started lashing out at people because they have been consumed with something. Not to go back, but thinking about that access to mental health, to healthcare and mental health has been one of the hugest things that has such a domino effect. Because if someone can't, they know they need services, and they feel, not saying what's factual, but they feel like they can't get access to it, they're not going to be likely to reach out. And so what me and Glenn find ourselves doing is a lot of dealing with situational issues before we can deal with anything that's really underlying. We're having to help with social services like housing, people needing food, people trying to see how they're finna feed. We had the formula shortage that came up, and it's just ironic because you also had Roe versus Wade pass, and so you have people who are concerned with, how would that affect me? Primarily because it was a shocker. I think a lot of people did not expect for it to be overturned, and so it's trickled to other things. But back to the formula shortage, it's kind of like, we're gonna force pregnancies, but we don't have formula right now to take care of the babies we have. So you have adults, parents, more their primary concerns are not mental health. Even though it's affecting their mental health, their primary concern is not mental health. Their primary concerns are their basic needs. All of these things are affecting their basic needs. Gun control. I know I talked to one patient who was very reactive, which is something we would address in mental health. He was very reactive to the gun control laws, just saying he's going to go buy up guns. Well, let's talk about it. Let's talk about it. But the gun control laws had that type of effect on him. Somebody else can pick up because I can go on and on.
Well, literally, I think, just to kind of rotating the mix, because I definitely want to come back to Doug. Landon, could you kind of touch on that? Because I think we're leading into this, which actually is, the way we were anticipating the conversation going, but it really is looking at these issues that we often don't spend enough time dissecting how they impact all these other things. And I think, so it almost gives us an opportunity to really think about what actions are happening. Are there processes in place to try to help connect the people with these services and these needs, beyond the efforts of individual providers like MAO? What are the actions that are happening that may help have services be more accessible, so that potentially, people may be a little less reactive through access? Because I really do think that we all are reactive. I can tell you that, like, literally, as soon as one of these issues, whether it was the increasing gas prices or my own conflicting feelings about the gun laws, and definitely, Roe versus Wade, which, even at the age I'm in, I never actually thought anything would change with it. It was always a topic of debate, but I seriously kind of made an assumption. So, Landon, could you kind of just give us a little bit of kind of a sweeping? What is happening?
I don't think we have enough time on one presentation to talk about everything happening at the state level or the federal level. But there's a lot happening. And I would love to echo Deidre, and I'm hearing a lot of concern and fear too. And one thing that I'm hearing too is a lot of hopelessness. I'm hearing so many people say the system is so broken, there's no chance to fix it. What do we do? And I'm hearing people be less likely to engage. And kind of like where we started this conversation, I think, and I will defer to the mental health professionals on this one, but I think a really good antidote to despair is getting to work, getting with people, finding a way, even if it's not changing the broad policy, even if it's just taking a granular step and connecting with a group of people that are interested in the same thing you're interested in. I think that in and of itself helps us to feel part of a community and helps us to kind of fight that despair. But, I would also say democracy is a spectator sport. The only way that this experiment in democracy, this republic works is if we are all at the table. And so there are kind of multiple fronts on this. So it's about making sure that there are seats for everyone at the table, but then it's up to us to make sure that we go and sit in those seats and make our voices heard. And that's frankly the only way that democracy will survive, is if we all engage in the process and if we're all willing to show up. On the abortion issue, it is incredibly concerning. Since the overturning of Roe v. Wade, in just over about a month or so, I was reading an article today, there are 7 states currently that have no abortion access whatsoever. And in those 7 states, one of which being Alabama, and in those 7 states, there have been 43 clinics that have closed in about a month. And most of those clinics closed in Texas. That's another one of the 7 states. And so you've got a situation where you've got folks who, you're shutting off access to abortion, but there's no public transportation. Housing is unstable. So if you've got somebody who's already scraping by, they have an unintended pregnancy, or God forbid, a rape situation, or, domestic violence and sexual abuse situation. And, they might want to take the option of terminating that pregnancy. But now we're in a situation where too many women all women in Alabama and several of these states will have to travel across state lines, pay a ton of money, and it's frankly not feasible. And so there's a lot of concern going forward around that issue and so many. But so what's going on and how to connect? It's interesting. I read a story this week, and I think we talk about this idea of intersectionality. So one thing that impacts all of these issues is taxation. And in Alabama, we have our tax code actually written into the state constitution. And we are the least taxed state in the nation consistently. You could double Alabama's property tax and it would still be the lowest state property tax in the nation. And those are the taxes that fund education, that fund access to healthcare, that fund roads and bridges that every single one of us drives on. And it's endless. And so the reality is the Alabama state constitution that was passed in 1901 in response to Reconstruction, and the folks who wrote the Alabama Constitution made it really clear from day one what they were doing. They were writing that Constitution to keep poor people poor and to enforce white supremacy. That's why they did it. And our tax code is written into that Constitution and lingers to this day. And so the reality is, statewide, our programs are starved of finances. And so the reality is they're not going to be able to provide the services they need to provide until they have the resources they need to provide those services.
Well, I think this is something, and I know because of, some of what Doug does now, but also knowing that he, like a couple of us, has had the luxury of working through several different positions over time, including supporting housing for clients and everything else. If I could jump to him and then I think to Glenn, really to kind of look at that type of, while we're looking at this higher umbrella level, what do we see agencies doing? Because we know literally, until we can get the bigger picture, I know that there's a lot of private effort to try to be helping people. And I think, looking at what types of resources are we finding that we're connecting people with for the supports they need? Because I'm glad Landon brought up transportation. Transportation, to me, one of the biggest underlying concerns in this state, because it underscores literally everything in daily life. But Doug, if you could just kind of touch on, what you're becoming aware of, what are these resources that we're seeing may help, at least in the short term, alleviate helping some of these people that they really do just need to try to get access to wherever they can get the services from?
Well, that's a good question, because there are services out there, but I think one of the things that I'm seeing a lot of times is there are services out there for people, resources, but not knowing the information about those resources and how things are operating and what is required is hindering a lot of people. It's kind of like the services that are out there and the requirements for those services are not actually being structured enough so people can inform themselves to say, hey, let me read this information to see if I actually fit a criteria. Now, sometimes the services, the resources that we have, the criterias are also another barrier, because if you have agencies that are supposed to help, they have so many criterias and so many, when you go down the list and check off to see which one you are qualified for, out of those checks, they've probably checked 5. So now that's not a resource for them. I also see that there are the knowledge of resources available because we're not communicating with other resources. Just for example, what you said, me being out in the community, just recently, I just happened to talk up on transportation. A guy and his wife have had transportation services for 7 years, and just so happened that he has a transportation company that actually assists us, but they're also having issues with their transportation, but he did not know that there were other transportation resources available. And they're right here in Montgomery. And it's kind of like everybody is doing their own thing, but not communicating and connecting. And that's the same thing that Deidre was saying about kids being concerned about a lot of stuff when it's time to go back to school. But just recently, again, there's one person who is putting on a big school fair for kids going back to school, but the only way she was connected to me is because I just so happened to be in an event. And I think we need to master and start working on how to have the resources connect, and then at the same time we're having those resources connect. It does not mean that we're taking away from other resources. It's just that we need to connect so I can know that you are actually available. I think that's one of the things that I'm seeing with a lot of people is like, I hate to use the word stingy, but it's kind of like, hey, I offer a transportation service or I offer behavioral health services, and let me give you my business card, but that's all you get.
Exactly.
Especially if they found out, oh, you have behavioral health services too. We do, but we may not be able to do something that you can offer our clients. And I think, and I think it's kind of like people being intimidated and not connecting and communicating, if that makes sense.
Well, I think that's, it's a good action. I know that, MAO kind of, we try to do a little bit more than what I think, we wish we could do more, but I do think that MAO makes a commitment, and I'm sure I could say for everybody, I think that's a great advocacy position for all of us, is about, trying to encourage the awareness of the services that are there, trying to make sure, while we're also trying to work on the back end to kind of improve the landscape, but also figure out, what can we collectively do to make each of us and the community aware. Because like you said, I mean, you kind of have to be aware of the service, and even if you have one, you may not be aware that there's another option if you lose that form of support. Because if you don't have a professional that's basically playing that critical social worker role and mapping it out in real detail of, okay, when that falls off, you need to call so and so. I think it's the community response of trying to figure out, instead of waiting, all of us trying to do our part to be aware of these services, whether it's for ourselves or for others.
And one last thing is also broadening our services or looking at our own services to see and asking ourselves, who do we really want to help? I prefer you tell me the truth as opposed to services being available, but when it becomes to different groups of people, they're not available. Even in the homeless sector, if you're dealing with homeless people, you're dealing with homeless people, and not depending on who the homeless person is. And that goes across all services, and that's what we're also seeing with a lot of clients. And as well as everyone on here knows, where we work at, that becomes the thing. Hey, do you provide transportation? Yes, we do. But when they find out where they may have to pick the client up from, it's an issue.
Okay. Yeah, I mean, I completely agree with what you're saying, and I'm sure that each of us, if we could run this program for 2 hours, we probably would love to just sit down and dissect how we could make those pieces work a little better. But again, we do have a finite amount of time, and I know you have very busy schedules, and we are going to run over by a couple minutes. But I think I'm going to jump ahead to a question that I literally did not come up with, but I completely agree with. And I think it's something I would just like each of you to maybe spend 2 minutes addressing, because I think each of you lends a different perspective to this question, and you'll understand what I mean. What can behavioral health providers do to support patients and family members who have been impacted by recent federal and social change issues? You can articulate from the advocate point of view, or you can respond from the provider point of view, but I think it really gets to the cusp of, we all may have part of the answer.
I'll go.
Thanks, Glenn.
One thing that is a very pervasive theme in counseling, working with clients, is often a person is they have not developed sufficient coping skills to adapt to change. And so they'll have very maladaptive, problematic reactions and overreactions to situations out of their immediate control that lead to substance misuse, other, pleasure-seeking behaviors to try to escape the pain of their reality. And it's an existential and a philosophical gap where the person, as a behavioral health professional, you work to help people understand change is natural, change is inevitable, life ebbs and flows. There will be peace, there will be war, there will be good times, there will be bad times, there will be pain, there will be pleasure, and developing coping skills to ride the wave, whatever the wave is, understanding that however things are right now, it's going to change. You just have to get from point A to point B and keep it together and keep it between the lines. And to borrow from Landon, if there's changes you need and want to make, connecting with like-minded people to work toward those changes and doing practical things to make those things happen.
Okay. Same question, but understandably from a different perspective.
So for me, for a lot of the individuals that I encounter who are specifically having detrimental concerns about the things that are happening, as Glenn mentioned, outside of their control, immediate control, I give them that listening ear. For a lot of them, they just want to be heard. They want to vent. They want to express. So I give them that listening ear. I also help them feel validated because honestly, I feel them. I understand. I mean, it can be a mess. Life can be a mess at times. And some things, like we mentioned, are out of their immediate control, but they also directly affect them. So just validating them. And then linking back to what Doug was saying about resources, if I hear someone mention something like, and with Glenn and Landon, and I just feel like, if they say something like, I just want to, what can I do? Boom. In my mind, I'm immediately like, okay, well, let's see what kind of support groups there are, advocacy groups. And I ask them, is that something you're interested in? And they'll be like, oh, I didn't think of that in that way. Even if they don't immediately accept it, having some type of readily resource or information available helps people feel confident in change. That helps them feel confident in it. If you just sit there and tell them, I know it's bad, and that's the end of it, they kind of didn't get anything from that, So having something to give them in return for them expressing how they're feeling is very, very, very helpful. And it helps with lifting some of that despair because they know they're not alone, that there is something available, not just resources, but support groups have been very, very, very important. Because support groups can turn to advocacy groups with the right person in it. So having a support group, and it doesn't have to always be centered around mental health. While mental health it's just inevitable for it to be a part of any support group because you have to take care of the whole person. So you're going to talk about mental health. You're probably going to talk about physical health as well as medication management, getting access to medical care, all of that. It also helps that person feel a part of something. And as Landon mentioned at the beginning, with all of us feeling some type of isolation, and the things that go on around the world does not assist in that. So it can make a person feel more isolated, but helping someone know that you're not alone and that there are things out there, resources out there. And while there are barriers to some resources, it's really, really good to know, make sure that when you're providing a resource to someone, you're not helping enable them in that way. What I mean by that is that I wouldn't give someone who doesn't have a car or transportation a resource of something they can't access. So, and this is just a word out to other agencies too, a friendly shout out. Remember to provide appropriate, readily available resources to our constituents, because they don't want to go to call a number and it's disconnected. And now they like, well, what I'm supposed to do now?
Mhm.
So just make sure that as agencies on our part, that the information that we're providing is accurate, factual, and actually helpful.
Doug, do you want to address that? Because I want to round back to Landon for the last comment, only because I wanted to answer that, but there's another piece to it that I actually would like him to.
Right. Well, she said all of it. I just piggyback on what Deidre said, which makes a lot of sense. And then I think about how our clients and people felt when they were this right here, the issues that are going on, even with COVID and all of these things that have happened. I've talked to it with a lot of clients, which have it's taught them a lot about being prepared and looking at things a different way. And when resources are opened up, go and try to establish yourselves in resources so you'll be remembered. And the reason why I say that, because I look at our clients and where they live and the things that they faced when no one never thought that we would shut down. So no one ever said, you know what, you can always get in the car and just drive to the store. You know, you never plan to say, hey, like I live in the rural area, so we're always getting more than one thing of water. But that's natural for me. But for people who never thought the world was shut down, they had 2 bottles of water in the refrigerator, you know, because they're down the street from the store, but they never thought that the store would close. So when I tell clients about preparing themselves, because I saw how parents did not know what to do with a child that they had to go to work and leave at home and hope that they would do their homework and hope that they would actually get a laptop. Or if they didn't have cable at all, how were they going to do their homework or survive or order groceries or do things with, you know, online and things like that? And I see that a lot. So I agree with Deidre, having resources that help and that are really going to help in matters, because it's like, hey, you can get this resource and you can come pick up a laptop for your child to get on school, but then no one ever asks, hey, how far do you live when you get off the school bus? You know, yeah, I do watch TV, but how do we know how they were watching TV before the pandemic showed up? And sometimes kids just waited till they got to school.
I think you expanded beautifully on that. It's about appropriate, making sure that when you're giving the assistance or the resource that you're completely conscious of. Does that resource require access to another resource in order to capitalize on it? And I think
correctly,
that's something that, again, it's basically, it requires all of us once again to kind of take a pause and step back and make sure that having and providing the resources is one thing. Let's give those resources a little bit of thought so that they actually can be utilized. You brought up the tablet, and of course, we've all heard the stories throughout COVID, which I know the isolation factor alone, but the fact that, to give a student a tablet, which is wonderful in and of itself. I come from a very poor family, but if it requires the internet, and although there has been ongoing efforts to try to expand that, if that expansion still has not really carried much into where they live, it makes a beautiful paperweight.
Mm-hmm.
So anyway, with that said, I also want to, I want Landon to chime in with his own view on that perspective, but also as kind of a closing comment that I really would like him to make. And it actually has to do with one of our motivations for scheduling this chat session when we did. And that is the fact that we are approaching the end of the month of July, which is National Minority Mental Health Month, which is growing in its recognition, and even with multiple renamings considerations, because we really have to revisit our definition of what is a minority. And yet we are also still simultaneously having to deal with the fact that there are systemic issues that one of which Landon mentioned earlier in terms of even the origination of the Alabama Constitution. But without us getting, partisan, I do think there's valuable understanding to be had by realizing that where the problems are across the board, these problems also impact certain aspects of our population with great extreme. So with that added burden, Landon, if you wouldn't mind, just kind of share your views, and if you could just kind of speculate about this impact, because it's impacting some even more severe than others.
Absolutely. So, a few things. I'm glad that Glenn mentioned about change being inevitable. This is going to sound a little bit like a fortune cookie, but it's true. We have a decision every day whether the world is going to impact us or whether we are going to impact the world. And both of those things can be true at the same time, to be sure. But it's a framing and a mentality. And like Deidre was saying, it's about building that confidence and it's about building that power. And when you give somebody an avenue to impact an issue that they are unhappy about, they feel that they have that power and they have that ability to make change. And it really does build on itself. So yeah, you get to choose every single day whether the world's going to impact you or whether you're going to impact the world. And on the issue of racial injustice and all of the many issues we're facing, this comes part and parcel right back to the concept of intersectionality, right? So if you've got someone who is living in the Alabama Black Belt, doesn't have stable housing, when they do, it doesn't have adequate sewage infrastructure, who doesn't have transportation, who isn't covered by healthcare, who's also Black, you're facing a lot of burdens and barriers. You have a lot more to overcome. And so some of these kind of disadvantages stack on each other. So, if you take a Black trans person from rural Alabama, they're going to be overcoming that much more, when you layer on these levels. And, you mentioned partisanship, Thomas. I don't think human rights is a partisan issue. I think we can go look at the UN's Universal Declaration of Human Rights, and it gives us a really crystal clear and concise guidebook on what it means to be a modern democracy focused on human rights. And unfortunately, I think if we look at America today and the direction we're headed, and if we look at Alabama, there are a lot of things that we do and a lot of things we're passing that don't square with that Declaration of Human Rights. And so
this is really what I wanted to get to. So if you can kind of, for the viewers and listeners, about some actions, basically about, trying to give them some tips about how they can get involved in change making.
Absolutely. Well, first and foremost, always vote. Be registered to vote. Be ready to vote. There's the primary elections, the general elections. We do a lot of trainings and education sessions around the elections, so you know who's going to be on the ballot, what those offices do. Get informed about the candidates. Make sure you're registered. Show up and vote in every single election. Even if you don't think that there's a chance that your candidate will win, even if you think your candidate's going to win, there are other races on that ballot. And that's another thing that I always try to remind people of. We get so hung up on what's going on at the federal level. Sometimes we get hung up on what's going on at the state level, but we often neglect what's going on in our own communities. And those offices that have the most impact on our daily lives are often those offices that are closest to home. So like city council, county commission, your district attorney, your local judges. So, be involved in those elections. Make sure you're showing up to vote in every election. If you have any questions or trouble getting registered, please reach out. We're happy to help. Other than that, definitely do find communities of like-minded people. Find people that are concerned about the same issues that you're concerned about, band together with those people and work to make change. And so what does that look like? It looks like writing op-eds and sending to the local newspaper. It looks like calling and emailing your elected officials. Sometimes it looks like staging a protest on the State House steps. I mean, there are a lot of ways to get your message out there and to get attention for your message. But at the end of the day, you know, all of these elected officials, they are all human beings. Most of them are relatively accessible. You know, some of the executives, like, you know, governor or president, may be hard to get to, but a lot of our like state legislators and even a lot of our U.S. Congress people and U.S. senators, while you may not be able to talk to them, you can talk to somebody on their staff who will relay that message. So be in touch. Make sure they hear your voice. Make sure they hear what you're concerned about, because what they're most concerned about typically is re-election. And if they know that their constituents are concerned about an issue, they're going to try to get on board with their constituents. So the more people that can call and express an opinion and the more often you can stay in touch with your elected officials, the more power you will have in affecting these issues.
Do you want to also quickly, and again, I know we're over time, but this is something that, and I'm sure you agree with me, we actually never have the platform or the opportunity to talk about enough. And that is about voting restoration. How many people out there think that because of one circumstance or another, that it sweepingly means they can't get their voting rights back? Would you mind just addressing that briefly?
I would be more than happy to. It's one of my favorite things to talk about. So it varies from state to state. So the information we're about to discuss is relevant only to Alabama. It does vary from state to state. But in Alabama, in 2017, we passed a new law defining what crimes of moral turpitude were. So that 1901 Constitution we talked about earlier, in that Constitution, it barred anyone from voting who had been convicted of a crime of moral turpitude. The problem is the state never defined that. So we had 67 different counties with 67 different lists of what would keep you from voting. So in 2017, the state finally passed a comprehensive list. It's about 45 convictions that will cause you to lose your right to vote. And, you know, these don't include like minor infractions. They don't include drug possession. Drug trafficking is on the list, but it doesn't include drug possession. And so there are a lot of convictions that you will never lose your right to vote. And that's very important to know. It's only about 45 convictions in the state of Alabama that can cause you to lose your right to vote. And even if you do lose your right to vote, there is a process for restoration. So if you've been impacted by the criminal justice system, please let us know. We love to help you get your rights to vote restored. I think, you know, that's important. And we're going to wrap up here in a second. And I will ask all the viewers and things to do pay attention, because there will be some kind of short presented informational slides at the end that have phone numbers and resources for you to capture and or revisit, because the session will be taped and recorded for future use. But I do want to just kind of reiterate, I think one of the important points of Landon clarifying that is just, when you vote, you are exercising probably one of the most empowering activities you can of your life. And if you think that that right has been taken away from you, you owe it to yourself to make sure that is true. The fact that you may fall under that new definition, that you have every absolute right to vote under the current circumstances, but make sure that you do know. And I say that because from one of our own clients in conversation one day, she had made the complete assumption that something that happened, and it was just a possession charge years ago, that nothing had ever changed, and that she couldn't vote. And it was just like, okay, see, this is why we have parts of the agency and partners in the community, because my fear is that there are way too many people who have that assumption, and they don't know that some things have changed, and that voting is their constitutional right. So, and I think, you know, again, from that sense of empowerment, that's what we're all here for. We all bring parts of what we do to the table to try to improve the lives of everyone. During Minority Mental Health Month, we really want to try to play a collective role of making sure that we bring people together to improve circumstances that directly or indirectly improve mental health, behavioral health in the broadest concept, because human behavior is what we live with, it's what we navigate, and it's either what unites us or divides us. So I do thank each and every one of the panel members for joining us today.
I think that there's an ample opportunity for everyone to have a list of questions. I do encourage our viewers and listeners, if you do have questions that you would like posed to Doug, Deidre, Glenn, or Landon, feel free to email us at info@maoi.org. That's info@maoi.org. And I will forward those messages directly to them so that they can start a direct dialogue with you. Again, MAO is not only a care provider, we are an agency dedicated to the effective and objective education to improve rural health in South Alabama. So again, thank you all. Thanks for joining us for this episode of Mental Health Matters, because what? Mental health matters to everyone, and not just in July, but all year long. So thank you again to the panelists, and thank you to our viewers. Catch us next time in November. Oh, nope, September. We have one before then. September, we will be focusing on topics related to suicide prevention and recovery. So thank you.